Have you ever heard about alkaptonuria? And did you know it could potentially have serious implications for the heart? This might come as a surprise to some, but alkaptonuria, a rare inherited metabolic disorder, is known to affect multiple organ systems within the human body. That's right, not just metabolism, but it can impact your heart too. This disorder influences the cardiovascular system through the deposition of a substance known as ochronotic pigment within crucial parts of the system like the heart valves, endocardium, aortic intima, and even the coronary arteries. So what does this imply? Well, it means that individuals diagnosed with alkaptonuria could potentially face heart-related complications. This revelation is of great significance as it broadens our understanding of the disorder beyond just metabolism. While alkaptonuria is primarily known for its metabolic implications, it seems to have a significant impact on the cardiovascular health of patients. Let's delve into a recent comprehensive evaluation of the cardiovascular status in individuals with alkaptonuria. This recent study took a detailed look at 16 patients previously diagnosed with alkaptonuria. Through a combination of electrocardiographic and echocardiographic assessments, researchers conducted a thorough examination of the cardiovascular health of these patients. One of the most significant findings of this study was the discovery of a previously unknown burden of aortic valve disease among alkaptonuria patients. With a prevalence surpassing 40% upon entering the fifth decade of life, this finding sheds new light on the cardiovascular implications of this metabolic disorder. The study found that the development of aortic valve disease was not only prevalent but also progressive. As patients aged, both the prevalence and severity of aortic valve disease increased. This underscores the need for long-term medical surveillance and management of alkaptonuria patients, particularly concerning aortic valve disease. Interestingly, the study also found a negligible presence of mitral valve disease and coronary artery disease in these patients. This is contrary to previous reports that highlighted a substantial burden of these conditions among alkaptonuria patients. This discrepancy can possibly be attributed to the limited scale of previous studies, which may have led to an overestimation of the prevalence of these conditions. These findings not only provide a deeper insight into the cardiovascular implications of alkaptonuria, but also highlight the need for larger-scale studies. After all, understanding the true prevalence and severity of these conditions can significantly impact the way we monitor and manage this rare disorder. In light of these findings, it becomes crucial for healthcare providers to maintain a structured monitoring program for alkaptonuria patients, especially those above the age of 40. Regular echocardiographic surveillance can facilitate early diagnosis of aortic valve disease and enable prompt intervention, potentially mitigating the health complications arising from late-stage detection. Contrary to previous reports, this study found a negligible presence of mitral valve disease and coronary artery disease in these patients. What do these findings imply for patients in the medical community, you may ask? Well, they shed a whole new light on the cardiovascular implications of alkaptonuria. They reveal that aortic valve disease, a previously overlooked condition, could be a significant burden for patients with alkaptonuria, especially as they age. This realization underscores the need for a structured monitoring program, particularly focused on aortic valve disease. It's crucial that we pay heed to this condition given its escalating prevalence and severity with age. We need to ensure that we're not just treating the metabolic aspect of alkaptonuria, but also taking into account the possible cardiovascular complications. For patients diagnosed with alkaptonuria who are over 40 years old, vigilant echocardiographic surveillance becomes paramount. This approach could facilitate the early diagnosis of aortic valve disease, allowing for timely intervention. Early detection is vital because it can help mitigate the health complications that arise from late-stage detection. It's about preserving quality of life and ensuring patients have access to the treatment they need when they need it. But it's not just about the individual patient. Community-centered awareness of the cardiovascular manifestations of alkaptonuria can significantly alter the course of disease management. By spreading knowledge of these findings, we can ensure that more people are informed about the potential risks and can therefore take appropriate action. For physicians and the wider medical community, these findings serve as a stark reminder to factor in these insights when devising a comprehensive care plan for patients with alkaptonuria. It's about remaining conscious of the possibility of underrepresented or overlooked cardiovascular complications. There's a need to shift the narrative to broaden our understanding of alkaptonuria beyond its metabolic implications. To do so, we must embrace these findings and incorporate them into our approach to patient care. In essence, these findings reinforce the need for a comprehensive care plan for patients with alkaptonuria. They emphasize the importance of a multidisciplinary approach that takes into account not just the metabolic disorder, but also the potential cardiovascular complications. This is the path forward in ensuring optimal care for those living with alkaptonuria. These findings, though significant, are just the beginning. The observed associations between alkaptonuria and cardiovascular disease, particularly aortic valve disease, have opened up new vistas of investigation. They have shed light on the intricate complexities of this inherited metabolic disorder, underscoring the need for further research to validate these associations and unearth deeper insights. Our understanding of alkaptonuria until now has been largely limited to its metabolic implications. However, these recent findings suggest that this rare disorder may wield a significant influence on cardiovascular health. An increased incidence of aortic valve disease among patients diagnosed with alkaptonuria, especially those above the age of 40, is a revelation that cannot be overlooked. The need of the hour is larger-scale studies that can reaffirm these findings. Such investigations can potentially pioneer a paradigm shift in how we understand, monitor, and treat the cardiovascular manifestations of alkaptonuria. They can help us devise better, more comprehensive care plans for patients, factoring in these newly discovered cardiovascular complications. Furthermore, these studies can aid in the development of structured monitoring programs, particularly for aortic valve disease, thereby facilitating early diagnosis and timely intervention. This can significantly alter the course of disease management, potentially mitigating the health complications arising from late-stage detection. Community-centered awareness about these cardiovascular implications is also crucial. It can empower patients and their caregivers with the necessary knowledge to make informed decisions about their health. Moreover, it can encourage healthcare professionals to remain vigilant about the possible underrepresented or overlooked cardiovascular complications in patients diagnosed with alkaptonuria. In conclusion, while alkaptonuria is primarily known for its metabolic implications, it holds significant potential to impact cardiovascular health, most notably, an increased incidence of aortic valve disease. As we continue to delve deeper into this complex disorder, it is paramount to keep in mind that our understanding is constantly evolving, and there is always room for further research, new insights, and better treatments.